Hi, everyone. Welcome. I'm James Milan, and this is COVID-19 update for this week. And we are joined, as almost always, by our town manager, Adam Chapdelaine. Hello, Adam.
Hey, James.
Um, Nice to see you in your office and with your Arlington, proudly wearing your yeah.
I'm
There you
mirrored.
go.
I was pointing to the wrong side.
Um, anyway, we'll get right to it. We'd like to get a COVID-19 update, of course, the status of what's going on in town, and then also we want to hear about this third round of emergency financial help for tenants in Arlington. But let's start with the update. What's the status in town?
So I think the status, as we've said for a while now, remains fairly steady state. We're still seeing transmission, not really a change in one direction or the other in terms of positivity rates. So we still remain worried about the variants. Still feel positive about people getting vaccinated, and I would echo the message that I've been echoing for quite a while now. We still need to be careful, mask when appropriate, socially distance as appropriate, and still trying to limit your interactions with people outside of your household if you're not vaccinated, and especially if they're not vaccinated. So I think the public health guidelines remain in effect, but as we continue to see these numbers of folks that are getting vaccinated rise on a daily basis, we become more and more hopeful that I think it was a couple months ago we were talking about a light at the end of the tunnel that we could see and almost touch, and feels a little closer. I think we still got a little further to go, but the light's still there.
Amen. And actually, on that, and talking about the number of people covered, we had an inquiry from a viewer who brought up a couple of interesting points. One of which is that there seems to be, nonetheless, despite the fact that the vaccines keep rolling out here in town or for our population, there seems to be a need still to close the vaccination gap with a cohort that we have talked about for a few months now, and that is 75 plus year old town residents. Many of whom may be homebound, etc. But in terms of receiving the first shot, it looks like the numbers would indicate that they're sitting at about 80% of them having received at least a first shot, and with roughly about 700 people not having received a single shot yet. And that, not sure how that compares with neighboring towns or other kinds of data, but I'm wondering if you could speak to the concerns of this particular resident.
Yeah, absolutely. And I did have the opportunity to talk with Christine Bongiorno, Director of Health and Human Services, about this concern. And a quick look at the data, which comes from last week, and I think it'll actually be updated today and put on the state website, is that we, in that 75 plus population, we are trailing on a percentage basis Lexington, Belmont, and Winchester and Cambridge, but have better percentages than Medford and Somerville. So in terms of our contiguous communities, we're just below the middle of the pack in that regard. And I think there's a couple things at play. One, we think that the communities that are doing better than us, it's likely the seniors living in those communities have a more robust social and or family network that have been able to provide them travel or even website assistance in gaining access to appointments. Or at least that's, we haven't analyzed that, but that's our general sense. Another portion of that, which can be somewhat explained in terms of Lexington and Belmont, is, as I think we can recall from a couple months ago, we were getting 100 shots per community in our partnership with Lexington and Belmont. Obviously, we have 10,000 more residents than Lexington, and I don't want to get this wrong, but maybe 20-some thousand more residents than Belmont. So we're bigger communities, but we were sharing those 100 shots, not proportionally, but equally across all three communities. So we think that might have something to do with the percentages being a little off in terms of how many folks in that 75 plus criteria or category have been vaccinated. Another issue is, and this would impact all the communities similarly, we were in the midst of our homebound vaccination program when the J&J shot got paused last week. So that was probably another 50 to 75 seniors we were going to be able to get to that have been put on pause, but we're hoping to pick back up with them with Moderna shots in the next week or so. So all that said, I'm happy that this viewer called attention to it, so that we could focus more closely on it. HHS is going to continue to focus on it. We're not going to be direct vaccinators, but we're going to keep doing whatever we can to try to provide access as best possible to this population and other populations as well.
Yeah, and I understand, of course, that there are, we can control only what we can control here in town, and most importantly, the supply of vaccine is really the determining factor. But the one other question that this viewer had, and I want to get it in the way that he framed it, has to do with the opposite end of the population to some degree, or at least the vaccinatable at the moment population. And that is what he's wondering, what the town or state's plans are to get the 16 to 30-year-old cohort vaccinated, since, as he puts it, they are the most mobile, the least vaccinated up till this point, and seem to be driving the most cases at this time.
All
so
true.
if you can speak to that.
Yeah, I would say from a town perspective, I think the most we can do is continue messaging about the need to get vaccinated when you can access it. We won't have vaccine that we can provide to people in that 16 to 30 age group. We won't really have any vaccine to provide anybody going forward. We are part of the regional collaborative we spoke about in the past, but that regional collaborative, though approved by the state, has still yet to be granted any actual vaccine. So there doesn't seem to really be an avenue there yet for us to be able to vaccinate more residents. So I think on our end, continuing to message, social media, talking with you via this weekly update, town emails, trying to make sure we encourage people to get vaccinated, I think is what we can do at the town level. At the state level, I know in partnership with the federal government, they're trying to make sure that there is a vaccine available within 5 miles of everybody's home. And that's through the expansion of the pharmacy network. So access at CVS, Walgreens, Walmart, I think even Costco. Really, it feels like any place that has a pharmacy is going to be given vaccine either through the state or directly through the federal government. So I think that's the state's best effort. I'm less clear on what exactly they're doing with universities and colleges and potentially even employers. If they are going to directly provide vaccine to colleges and employers, I think that could be another avenue for that age range that we're talking about here. But I think in general, I'm not speaking for the state, but I think the effort is focused on making vaccine as widely available as possible so that it's easy for people to get, and hopefully then they access it.
Thank you for that. I want to make note of a couple of things before we move on. And one of those is that viewers may notice, and you've made your best efforts to do something about this, but they may notice that there's the visual quality of your image on this particular recording is not what all of us hope it to be. That's not a problem for you viewers with your televisions, and it's something, again, that Adam was and we were trying to resolve before we went on air. We weren't able to, but we wanted to push forward anyway. So we're getting a fuzzier view of Adam than usual, and that's never good. But bear with us because the content is worth it. And on that, thank you, Adam, for responding to those questions. And we do want to encourage that this particular part of the public conversation move forward. We're so glad that a viewer was watching and engaged by these and wanted to, or offered feedback and a couple of questions. We encourage our viewers to continue to do so, and we will do our best to incorporate those perspectives into these chats going forward. So thanks again, Adam, for that. Moving on, though, I had mentioned that there is an emergency tenant assistance program that is kicking into its third round, and please just elaborate on that for us.
Yeah, I think I would simply say that we still are seeing economic impacts from the pandemic. In some ways, those impacts are quieter in our community than maybe they are in other parts of the country, but they're still very much there. There are people that have suffered significant economic loss, instability, and unfortunately, that's corresponded to housing instability. So this will now be the third round of emergency tenant assistance that we're offering. So if you are in need of help paying your rent, and you qualify for this program, which you can look at eligibility on the town website, I strongly encourage you to apply. We want to do everything we can to help people with the funds that we have available. And again, this marks the third round. The first two rounds were successful in helping folks living in town, and we hope we get the same response to this one.
Moving on, so we are coming up on town meeting. It is starting this coming Monday, the 26th of April. And it is as packed an agenda as I can ever remember, with more than 90 articles on that agenda right now. So without asking you to review any of them, obviously specifically, can you provide any highlights of what the main things are before town meeting this year?
So I'm sure I will leave something out because of how much there is within the 91 articles, but I think there'll be a lot of good dialogue at town meeting this year. There's expected to be discussion and debate about declaring a climate emergency, about making Juneteenth an official town holiday, about changing Columbus Day to Indigenous Peoples Day, in regards to celebrating Prince Hall Day here in Arlington. So some very topical issues and related to race and related to climate change. And then to the important but more mundane operating budgets, capital budgets, zoning considerations that get at the production of affordable housing in town. So again, without chronicling with every article, I think it'll be a robust town meeting. I know the town moderator is attempting to do a pretty lengthy consent agenda to try to make sure to try to not have us all in town meeting for multiple months this year, but one way or the other.
Can you sorry, just clarify for folks who might not be aware what a consent agenda means?
A consent agenda is putting things on a list that only require one vote. So 10, 20, 30 articles, on one sheet of paper, one vote, and they're all disposed of based on what the recommended vote for each one is.
Right. So people can appreciate, I think, the value of the consent agenda when you're talking about 91 articles. So
yes, exactly. So yeah, it should be, and we're using the same platform we used in the fall to make sure we're keeping everybody safe from a public health point of view. So that same team of staff and volunteers have been working hard over the past few months to make sure that we're up and running for that. And we ask for everyone's patience. It's still, even though we did it in the fall, it's still new. And I'm sure there'll be some bumps, as there would be in person, but yet we feel confident using this virtual technology to make sure that we can conduct the town's business, but keep everybody safe and healthy at the same time.
I do remember talking to you back in the fall, post that town meeting and the special town meeting that happened in November. And, I remember you and I and others being pleasantly surprised by how well things went, even though, there were little glitches, et cetera. So let's keep our fingers crossed that you've learned, that the folks have learned even more lessons from that experience, and that things proceed smoothly. Because again, it is there's lots and lots to cover. Anything we've missed, Adam?
No, I think that covers everything for today. Again, not today, but the weather's warming up. So hopefully we can all access vaccine over the course of the next few months and start to get back to some semblance of normalcy as the summer sets in. Well,
we would all welcome that, as we know. We appreciate, again, as always, your time. And again, the fact we're mindful of the fact this is a little bit longer than a lot of updates, because we did want to deal with a little bit of extra content here, and hopefully our audience appreciates that. We appreciate you and your time. Thank you very much. I've been speaking to Adam Chapdelaine, our town manager, as part of this week's COVID-19 update here in town. I'm James Milan. We're grateful that you're here, and we'll see you next time.